At least 24 cases of measles have been reported in a West Texas county. Gaines County has one of the highest rates of vaccine exemptions in the entire state. And all of the confirmed measles cases there involved unvaccinated residents. I want to bring in infectious disease physician at Johns Hopkins, Amesh Adalja, to talk more about this. So, doctor, break down what we know about the current measles outbreak. I know in real numbers it's not a lot of people, but it is still troubling.
Yes, it is troubling because this is completely preventable. What we're seeing is one of the places in Texas that has the lowest vaccination rates, the highest school exemption rates from measles vaccination, having a measles outbreak, including hospitalizations of individuals who've been infected with measles. And I think this is really a reminder that measles is still a risk, and it is kind of the canary in the coal mine. It's the most contagious infectious disease known to humans. And when we start to see measles outbreak, that's a sign that there is a chink in the armor of vaccination. And the fact that it's preventable, I think, is what people should understand. This doesn't have to happen if we can get vaccination rates back to high levels again.
Doctor, we're just showing images coming into us from Gaines County, Texas, and we see the EMS workers. They're in full hazmat gear. What is the risk to adults? I'm vaccinated against the measles. My 2-year-old and my wife are vaccinated against the measles. She can't go to school here in New York without receiving that vaccine. But what would happen? I'm just amazed that those EMS workers are themselves wearing full hazmat suits.
If somebody is fully vaccinated against measles and has a normal immune system, they don't need to worry about measles. They're not going to be at risk for contracting measles because the vaccine is very, very effective. It's those individuals who are not vaccinated, or maybe they're too young to be vaccinated, or their parents have chose not to get them vaccinated. Those are where we start to see the cases. And I think they're just using kind of standard precautions there. But it is something that we take seriously when there are measles outbreaks. And think about all the public health resources that get diverted to deal with the measles outbreak that could be working on influenza, that could be working on COVID, that could be working on Mpox. They're now working on something that they shouldn't have to work on. This is something that should have been put to bed in the 1960s with the advent of the current vaccine.
It's unbelievable. All right, you mentioned influenza. We are seeing a rise in the spread of influenza. The CDC says flu deaths have surpassed COVID deaths nationwide for the first time since the start of the pandemic. So what is it in particular this year about the spread of flu? Again, I always wonder when I see these news reports coming out of local news stations about people being hospitalized for the flu, I wonder if these individuals are vaccinated. It's something that, again, my family and I do every year at the start of flu season. We get vaccinated because you never know. And I know that even if you are vaccinated, you can still catch the flu, but hopefully not end up in the hospital.
So this year's flu season is sort of kind of hearkening back to what it was like pre-COVID. And I think many people kind of have a little bit of an amnesia about how bad flu seasons could get. So that's what we're seeing is basically a return to pre-pandemic influenza. And this is something that is definitely impacted by lower vaccination rates. And as you said, flu vaccinations don't protect you always from influenza, but they do protect you from severe disease, hospitalization, and death. And many of the patients I've taken care of with influenza have not been vaccinated, that have been hospitalized. But there are some people that still can be hospitalized even if they have the vaccine. And this is a pretty rough flu season right now. We've seen schools have to close because there were too many cases to actually conduct class. We've seen pediatric deaths occur. And this also goes in line with vaccination rates falling. Vaccination rates in children have fallen. Vaccination rates in adults have fallen. We've seen the anti-vaccine movement kind of bleed from COVID into influenza. And again, this is something that we can minimize by the use of vaccines. If only about 50% or less of the population are getting vaccinated, you're going to see hospitalizations occur. You're going to see disruption occur that could be prevented if more people use the vaccine. The vaccine is a tool to get through respiratory viruses, and I think people need to see it that way.
Yeah, Doctor, when I was a foreign correspondent based in West Africa, I did multiple stories where entire villages were ravaged by preventable diseases, and in particular, in one case, polio, which at the time, Nigeria was one of 3 countries that still had polio cases. They've subsequently have been able to finally get rid of it. But I remember people who don't have a lot in life telling me that they couldn't imagine that a country as wealthy, as highly educated as the United States would have challenges with vaccines, given the abundance of the vaccines in the United States and the dearth of vaccines in West Africa. They couldn't wrap their heads around something that was preventable. Dr. Amesh Adalja, thank you very much, as always, for speaking with us.